to work through the underwear. How would you know what happens when, and she's doing it because she's being demoed on, I'm sure. And, but how would you encourage someone to take their, let's just say they have some hip problems and you want to really, get into the skin and really get into, manipulating and doing some, using some forearms. How do you think you would encourage that? Here's what happens. When people, there's a lot of different reasons people they don't feel comfortable enough taking their underwear off. It could be they're seeing you for the first time. It could be a female seeing a male client, not feeling comfortable about that. And it could also be the client just feeling a little weird about it. It's like, well, if I take my underwear off, is that going to be me suggesting something? Or is that, so it could be the client is not a modest person, but might be a little insecure as far as what am I projecting out to the therapist. So we have to try to figure out if they're not taking their underwear off, and we're needing to work this area, and really get into the skin more, into the tissue more. We have to figure out why that's not happening. So when you have a client on the table, you get them on the table, before you leave the room, you explain to them, how, if they've not had massage before, and it usually happens with first-time people, or either being with a therapist for the first time, you want them to undress to their comfort level. So you would say, well, I'm going to leave the room, and I want you to undress to your comfort level. And sometimes you have to go into more description, because if their comfort level, if they're really modest, and their comfort level is leaving their bra on, if it's a female, leaving her bra on also, and you've got to do back work, then you're really challenged. Or if they bring a swimsuit and they want you to work through the swimsuit. That's kind of rare. I mean, that doesn't happen that often. So they're going to set the boundaries, but you have to help them to feel comfortable on the table. So you need to know how to work both ways. You actually need to know if they had a bathing suit on, how would you work through that? You do a lot of compressions and rocking and that sort of thing. So as far as the glutes, that's the way you would approach the glutes. You're going to be doing a lot of fisting, forearm work. All right, so we left off the other day with, we included the back work, right? And so if her underwear were off, I would include some glute work using my hands, forearms, and actually going around the top of the femur, using my knuckles to strip down the gluteus, the glute minimus and medius, which go in this direction, the fibers. Glute max go in this direction. They're attached to the sacrum, the crest here, and then they come down and merge in to the IT band and attach onto the femur. So the muscle fibers run in this direction. So I would use, my knuckles to strip the muscle fibers of the glute max, and then use my knuckles to strip the muscle fibers of the glute minimus and medius. Really go in deep, and even using the heel of my hand to work those muscles.
Would that be over the sheet?
No,
or under.
That's
so like
if
we
would pretend like if
right.
she were. You care if I?
I'll care.
Yeah. Okay. Cool. Okay. So, and you can even ask that too if they have underwear on. If you feel, if you read them and feel like it's okay, you say, "Can I, get down onto your hips, into your glutes some, and could I put the sheet into the underwear?" It's okay to ask that. So then it would look like, just oil her up a little bit. So let's just say I've worked down from the ribs, the QLs into the glutes. And this can be a problem, I mean, it can come up, so you just keep tucking it back. So I can use my knuckles, stacking my joints. How's that feel?
I think the deeper if you want.
Deeper?
Firmer, yeah.
Okay. How's that?
That's good.
Good?
Mm-hmm.
Can also do this. And then glute backs. Watch my back leg. This was a case where I did lift the leg. Remember earlier I was telling you I do lift it sometimes and I couldn't remember when. This is hard for me to remember all the details. But do you see what I'm doing? What I'm doing is I'm lifting up, but I'm not applying pressure and holding that. So it's not like I'm, because you want the weight transfer to be back here, right? But what I'm doing is lifting up and I'm coming down because I'm having to come down on a slope, and that's why I'm doing that. I've got a good stack and then I'm just coming down, and then my weight transfer does end up on the back of my leg as I come down the glutes. Okay. So that would be how we do that. So if I'm going to work through the sheet, underwear, how could I loosen up the glutes? So in the video, the early on, I changed some things because of my own, I was, adjusting my own body mechanics from that video as I saw I was doing, because you can do this if you're not using a lot of pressure, but I find that I developed this pivot technique, and what I do is like I'm standing here, I've got my knee bent, but what I'm doing is pivoting around, still transferring my weight to the back of the leg, but I'm just moving in a sort of a pivot direction, so I can get all angles of the glutes. If they need really deep pressure, then you would want to just do the forearm. And you can still sort of pivot around somewhat, but then you're going to have to change in this direction. So be careful with the forearm, because if you're pushing on a bone, you don't feel it. You want to be right in here. And you can see how I'm really in a deep lunge here. And then you can finish off with just some rocking here. This is not deep, it's just basically a rock. And then I like to give a good stretch. So I have the heel in my hand, right at there's the sacrum, there's the crest. There's a nice little notch I can put that in. And then the heel of my hand at the top of the femur, and I'm just pushing toward her feet. See that? There's a shoe back there, but anyway. I was getting stuck on a shoe. I thought I was hitting someone's foot. Okay, there we go. See that? So I'm not holding it, although you could hold it. You don't want to go 90. You want to go 45. So you got to get into a deep lunge. If I was here, see, if I was in too close, you see what happens? I'm at 90 in my wrist. If I lunge deep enough, I'm at 45. And then I'm just, how's that feel?
Feels awesome.
Yeah, this is a great technique, this hip stretch. And when you add this little rock into it, it really, And if you're not in the right place with it, and it's not, so don't do this, like you're pushing in this direction, it has to be here. And it's like it's almost like a seesaw. Okay, let's do it again. Here, here. And then you can hold it. And then from there, if I wanted to move, if I'm moving down from, let's just say I worked the back and I worked my way into the hips, and I'm gonna move down the posterior leg, you can add some compressions. It's kinda like moving your way downward. Squeeze on the calves.